There are some popular posts on social media that say, if you have problems with the minor mistakes in these pictures, then you have OCD. After looking at the pictures, you feel disturbed and think that maybe you have OCD after all. What exactly is OCD? Is it really that simple to diagnose? Obsessive compulsive disorder, or OCD, is a mental disorder. It starts with an obsession, which is the unwanted and disturbing thoughts or images that are intrusive and reoccurring. To calm themselves from the obsession, the patients make a certain compulsion, repetitive actions or behaviors that are done excessively and may not be related to the obsession. Some scientists group OCD based on their main obsession. The classifications are 1. Obsession to contamination. Everyone with this type of OCD has an obsession that bacteria might infect them or their family, known as mysophobia or germophobia. So, they wash their hands every 5 minutes or so and spray everything with hand sanitizer as part of their compulsion. 2. Obsession with symmetry and orderliness. This leads to an excessive fear of oneself or his or her family getting hurt from things that are not in their place. So, the sufferer compulsively tidies up everywhere, every time, even to the smallest thing. This person can also be obsessed and stressed out on things that are not symmetrical or not in order. 3. Obsession to checking. For example, you feel particularly scared that your car might get stolen any time, so you keep checking it almost every second, peeking at the window and making sure your car is there. You also bring your car key all the time to repeatedly press the lock button. 4. Obsessive and intrusive thoughts. The thoughts can vary wildly, such as fear of having done an unforgivable sin or scrupulosity. Myth-related, such as believing some color or number can bring bad luck, and thoughts of doing violence-related actions. Signs and symptoms. Some of the signs that you need to look out on yourself or your loved ones are inability to sleep tightly because the obsession keeps waking one up in the middle of the night, highly concerned about small things or easily angered by them, struggling in life. The intrusive thoughts may severely impair one's social skills and career performance. The key sign is a person with OCD will spend a lot of time, about an hour per day, doing the compulsions in distress without having any pleasure at all. In other words, if a person just happens to love cleanliness or strives for perfection, does not experience any problem in daily activities, and carries out the chores happily and proudly, then the person is not having OCD. In children, males are affected more commonly, while in adults, females are affected at a slightly higher rate. An example of women-specific OCD is postpartum OCD. Causes. The causes of OCD are not fully understood yet, but there are some hypotheses regarding this. OCD is linked to genetic factors, so it can be inherited from your family line. It is caused by chemical, structural, and functional abnormalities in the brain. People with OCD learn the compulsion as they grow, and they make it a habit to relieve their obsession and anxiety. One of the causes in children is an immune-related condition known as PANDA. After bacterial infection, the antibodies mistakenly attack parts of the brain, causing obsession and compulsion action. Treatment. To help manage OCD, some available options are lock on your mind. When locking the door, capture it into your mind that it is indeed locked. When the urge to check arises in the future, you can recall it and calm yourself. Join a support group. Many links on the internet provide valuable information and tell others stories on their journey with OCD. But remember, always consult with a professional before taking any action. Seek psychological treatment, such as cognitive behavioral therapy, with exposure-response prevention. The therapist may give you a small dose of your obsession and prevent you from doing the compulsion. Then, it is gradually increased until you become numb to them and your OCD becomes suppressed. Medication may be needed if the therapy does not work or your OCD is in the severe stage. Selective serotonin reuptake inhibitors, such as citalopram, are used to increase the level of serotonin in the brain, reducing anxiety. To sum it up, checking on your stove once in a while after it has been used is not a symptom of OCD. But if you repeatedly have nightmares of fire at your house and wake up at night fearing fire from the stove, only to go to the kitchen and find nothing wrong, please contact your doctor.